I'm going to expose something that may genuinely disturb you, something that could be residing in your medicine drawer at this very moment, quietly damaging the most vital organ in your entire body. I'm Dr. Li Wen, and following 21 years as a cardiovascular surgeon, I've observed apparently healthy individuals enter my surgical suite with hearts compromised not by illness, but by pharmaceuticals they believed were completely safe. These aren't rare medications or investigational compounds. I'm referring to the pain medication you consumed this morning, the acid reflux tablet you took with your coffee, even the flu remedy you purchased last month without hesitation. What I'm preparing to disclose contradicts everything the medical establishment has communicated about these supposedly harmless drugs. The pharmaceutical industry doesn't want this information public. Most physicians won't mention it because they genuinely haven't recognized the catastrophic association, but I've witnessed it firsthand, case after case, after cardiac tissue, and I'm done remaining quiet. By the conclusion of this presentation, you'll know precisely which 5 medications are covertly deteriorating your cardiac muscle, why they're particularly hazardous past age 60, and critically, what actions you can implement immediately to safeguard yourself. This isn't alarmism. This is potentially life-preserving information. Stay engaged, because what you're going to discover could genuinely extend your lifespan. Let's begin with the medications present in practically every American household. The non-steroidal anti-inflammatory medications, or NSAIDs as they're abbreviated. You recognize them as ibuprofen, naproxen, and diclofenac. They're your immediate remedy for migraines, lower back discomfort, joint inflammation, and general aches. They function remarkably well. That's undeniable. But here's the revelation nobody shares with you. Consuming these tablets consistently past age 60, particularly if you have any cardiovascular concerns, is comparable to gambling with your heart's well-being. The scientific establishment has understood this troubling reality for many years. In 2005, the FDA mandated explicit warnings regarding cardiac arrest and cerebrovascular accident risks on these pharmaceuticals. Still, countless individuals continue consuming them routinely like vitamins, totally oblivious to the threat contained within each dose. Let me share Daniel's experience, a 71-year-old patient who was passionate about woodworking in his garage. He battled with shoulder arthritis and consumed ibuprofen nearly every single day to control the discomfort. One evening, while finishing a bookshelf project, he felt completely exhausted. He struggled to breathe properly, and his lower legs had expanded to double their typical size. When he reached the emergency department, we identified he was suffering acute cardiac failure. His heart, already operating under strain due to his age and moderate high blood pressure, simply couldn't sustain function anymore. The catalyst wasn't a fresh heart condition. It was the persistent consumption of that seemingly harmless anti-inflammatory medication. How can something so widespread be so harmful? The process is devastating. NSAIDs inhibit specific enzymes to diminish inflammation, but simultaneously, they also disrupt compounds that safeguard your kidneys and circulatory vessels. This generates 2 destructive consequences. First, they compel your system to accumulate sodium and fluid. Imagine your heart as a circulation pump. If abruptly there's substantially more liquid in the system, that pump must operate at peak intensity. A youthful heart can manage this pressure, but a heart that's already confronting age-related rigidity or combating elevated blood pressure can collapse entirely, just like Daniel experienced. Second, NSAIDs can narrow your circulatory vessels and raise blood pressure readings. Even if you don't currently have hypertension, consistent usage can increase it substantially. And if you're already consuming blood pressure pharmaceuticals, NSAIDs can entirely neutralize their effectiveness, causing your pressure to surge dangerously without your awareness. It's vital to recognize that the danger depends on quantity and frequency. Medications like diclofenac and high-dose ibuprofen, approximately 2,400 milligrams daily, demonstrate the strongest correlation with cardiac complications. Lower-dose naproxen seems moderately safer, but the danger is never eliminated. And here's another revelation. If you consume low-dose aspirin for cardiac protection, specific NSAIDs like ibuprofen can actually nullify that protective benefit completely. So what's the solution? The answer isn't enduring unnecessary suffering. It's initiating a frank discussion with your physician. Ask specifically, "Doctor, considering my health background, what's the safest pain management approach for me?" Options are available. Sometimes acetaminophen proves adequate. Other occasions, topical anti-inflammatory lotions or gels that function locally are superior choices. And if an NSAID is genuinely required, the fundamental principle is minimum dose for minimum duration. Now, we progress to number 4. And this one will genuinely astonish you because it's promoted as a stomach defender. I'm discussing proton pump inhibitors, or PPIs, omeprazole, pantoprazole, lansoprazole. These rank among the most dispensed medications globally. Countless individuals consume them every morning almost automatically for acid reflux or to shield their stomach from other medications like the NSAIDs we previously examined. And here's the troubling paradox. The medication prescribed to shield you from one danger might be manufacturing another threat through an unexpected pathway. Let me describe Patricia's situation, age 67, who was prescribed omeprazole for persistent acid reflux. She was instructed to consume it indefinitely. Her digestive discomfort vanished and she never reconsidered it. Years afterward, during a standard examination, her electrocardiogram displayed something abnormal. Laboratory work identified the explanation. Her magnesium concentrations had dropped to dangerously deficient levels. Magnesium serves as the protector of your heart's electrical rhythm. When it's exhausted, your heart becomes electrically volatile, like a symphony without coordination, and hazardous arrhythmias can develop. The source of Patricia's deficiency: chronic omeprazole consumption. PPIs diminish stomach acid production, but that acidity is fundamentally essential for nutrient absorption. When you suppress it long-term, magnesium uptake deteriorates dramatically, but the concerns extend further. There's something that troubles us considerably more. Numerous observational investigations have identified a correlation between PPI usage and elevated heart attack incidence. One hypothesis proposes these medications might decrease nitric oxide concentrations, a molecule maintaining your blood vessel flexibility. When it's reduced, vessels harden, establishing conditions for cardiac events. The direct causation remains contested, but the association is profoundly troubling. Furthermore, omeprazole can interfere with critical medications like clopidogrel, an antiplatelet medication administered following heart attacks. It can render this protective pharmaceutical less potent, leaving patients exposed. The fundamental issue is these drugs have become trivialized. They were developed for brief interventions of 4 to 8 weeks, but they've transformed into permanent solutions for conditions that could frequently be addressed with behavioral modifications. If you've been consuming a PPI for months or years, don't discontinue suddenly. Consult your physician. Ask, do I genuinely require this long-term? Can we decrease the dosage? Are alternatives available? And if you must consume it chronically, it's critical that your physician monitors your magnesium concentrations regularly. Before we advance with the subsequent medications, which include some for common respiratory infections, I want to make a brief appeal. If what you've learned thus far appears worthwhile, I'm requesting 2 straightforward actions. First, subscribe to this channel. My purpose is delivering transparent, evidence-based health guidance so you can make informed choices. Second, and possibly more significant, distribute this presentation. Consider your relatives, your elderly friends, your community members. A simple share can initiate a dialogue that could genuinely preserve a life. Thank you for supporting this mission. Let's proceed with number 3, one that virtually everyone keeps at home. We've reached number 3, oral decongestant medications for respiratory infections and influenza. The varieties containing pseudoephedrine or phenylephrine. They're the immediate solution for that congested nasal passage that persists relentlessly. But that immediate relief can impose an exceptionally severe price on your heart, particularly if you already manage high blood pressure or any cardiovascular condition. Dorothy, a 73-year-old former librarian, contracted a significant respiratory infection. To breathe more comfortably, she purchased a popular cold medication containing pseudoephedrine from her local pharmacy. By day 2, she felt like her heart was racing uncontrollably, along with severe lightheadedness and an intense headache. Her daughter transported her to the emergency room immediately. Her blood pressure was dangerously elevated, and she had developed an irregular heartbeat. That decongestant had pushed her cardiovascular system to crisis. Why does this occur? Pseudoephedrine and phenylephrine are vasoconstricting agents. Their mechanism is narrowing blood vessels. In your nasal passages, that's beneficial because it decreases swelling and facilitates breathing. But the medication doesn't function exclusively in your nose. It circulates throughout your complete circulatory system, constricting blood vessels systematically. This produces 2 consequences. First, by narrowing the arterial pathways, your heart must pump against substantially increased resistance. It's comparable to forcing liquid through a compressed tube. The pressure intensifies dramatically. This can trigger a dangerously elevated blood pressure surge. Second, they're cardiovascular stimulants. They accelerate your heartbeat and can induce irregularity. If you already possess a vulnerable heart, this additional stimulation can destabilize it entirely. Recently, European regulatory authorities have redirected scrutiny towards pseudoephedrine due to its association with infrequent but critical syndromes involving blood vessel constriction in cerebral tissue. This only confirms how potent its systemic effect throughout the entire organism. The principal hazard with these medications is their over-the-counter availability. Individuals purchase them without examining the warnings and without considering the cardiovascular implications. If you're past 60, and especially if you manage hypertension or any cardiac condition, eliminate them entirely. Much safer options exist. Saline nasal irrigation, steam humidification, or nasal corticosteroid sprays that function only locally. Don't permit relief for your respiratory symptoms to become a cardiac emergency. We progress to number 2, a sensitive but essential topic concerning mental wellness. I'm discussing an older category of antidepressant medications that are occasionally still prescribed for depression and sometimes for chronic pain conditions. Tricyclic antidepressants, names like amitriptyline or imipramine. Depression itself represents a risk factor for cardiovascular disease. That's why addressing it is vital. But the method we address it matters tremendously, and these pharmaceuticals can be hazardous for an older individual's heart. George, age 76, experienced severe neuropathic pain in his lower extremities from diabetes complications. His physician prescribed a modest dose of amitriptyline. It alleviated the pain, but he began experiencing dizziness whenever he stood upright. One afternoon, he lost consciousness and sustained a hip fracture from the fall. The cause was the amitriptyline, which induced a sudden blood pressure drop upon standing, termed orthostatic hypotension. But that's not the sole danger. These medications can also accelerate resting heart rate, meaning persistent stress for an aging cardiac system. And what's most alarming, they can disrupt the heart's electrical conduction system, decelerating impulse transmission. This appears on electrocardiographic readings and elevates the risk of extremely dangerous ventricular arrhythmias that can trigger sudden cardiac death. For these reasons, tricyclics are no longer the primary option for managing depression in older populations. Currently, we favor contemporary antidepressants that are cardiovascularly safer. However, they're still dispensed for neuropathic pain management. If you or a family member consumes one of these pharmaceuticals, it's imperative to discuss with your physician. Have safer alternatives been attempted? Are blood pressure and cardiac rhythm being monitored appropriately? Mental and physical wellness are interconnected. You must ensure that intervention for one isn't compromising the other. And we arrive at number 1. This is potentially the most contentious and debated point, but it's my obligation to communicate the concern existing in the scientific community. I'm discussing calcium supplementation. Yes, you heard accurately. Those tablets that countless individuals consume daily to safeguard their skeletal system from osteoporosis. For generations, the messaging was absolutely clear. Consume calcium for strong bones. But in recent years, increasingly more investigations are questioning the cardiovascular safety of these supplements. Let me describe Barbara's case, age 69. Concerned about osteoporosis, she initiated consuming a high-dose calcium supplement independently. Years subsequently, she experienced a heart attack. She didn't possess the conventional risk factors. She didn't smoke. Her cholesterol and blood pressure were acceptable. Investigating potential causes, her medical team concentrated on that daily supplement. The controversy is legitimate, and the evidence isn't conclusive, but the hypothesis concerns us profoundly. Calcium obtained from dietary sources like dairy products or vegetables doesn't appear problematic. It's absorbed gradually, and the organism utilizes it efficiently. The concern appears to emerge with the highly concentrated quantities from supplementation. When you consume a tablet, it generates an artificial calcium surge in your bloodstream. Your organism can't utilize all that calcium for skeletal tissue, and the surplus must be deposited somewhere. The primary concern is it accumulates in arterial walls. This process, arterial calcification, renders arteries inflexible and can contribute to forming the atherosclerotic plaques, causing heart attacks. Some extensive studies suggest calcium supplements moderately increase heart attack incidence, while other investigations haven't identified this connection. The evidence is nuanced, and for individuals with diagnosed osteoporosis, the benefits might exceed the risks. But the lesson is evident. More isn't superior. The safest approach is obtaining calcium from dietary intake. If your physician determines you require supplementation, never initiate it independently. It's a medical determination that must evaluate your skeletal health and, critically, your cardiovascular risk profile. Today, we've exposed the hidden consequences of 5 extremely common medication categories: anti-inflammatories, gastric acid suppressors, decongestants, certain antidepressants, and calcium supplements. My primary message isn't inducing panic. It's not discontinue your medications. Doing that independently would be extremely hazardous. My message is empowerment. Now you possess valuable knowledge that most individuals lack. You understand that the arthritis medication can overburden your heart. You understand that your stomach protector might be affecting your cardiac rhythm. You understand that a simple cold remedy can represent a serious cardiovascular risk. Utilize this knowledge to become an engaged participant in your wellness. The next occasion you visit your physician, arrive prepared. Bring a comprehensive list of everything you're consuming, including supplements and vitamins, and pose direct questions. Doctor, I've learned this medication could present cardiovascular risks. Is it still my optimal choice? Are safer alternatives available? Should we monitor something like blood pressure or conduct specific testing? Every intervention represents a balance between advantages and risks, and that balance transforms with age. Your heart has functioned tirelessly for decades. It deserves exceptional care. Protecting it is the most valuable investment you can make in your longevity. Don't accept any medication as harmless, regardless of how commonplace it appears. And now I'm requesting one final action from you. Share your perspective in the comments. Did something here surprise you? Your experiences can benefit others. And remember, always consult your physician. That conversation is the most critical step you can implement today to safeguard your heart for tomorrow. Take care of yourself.